Minister is ready. Minister.
Thank you, Madam Deputy Speaker. With permission, I'd like to make a statement on winter preparedness. And before I begin, I want to say a very special thank you to all the staff who will be keeping our NHS going over the Christmas holidays and into the new year. And when I was the manager in the NHS, I worked on winter planning. So if I can also make an extra additional thank you to all those people who often aren't unseen, but the managers and admin staff that also keep the system going. Because I know how hard it is for people to work in this system, the challenges that winter can bring with increased demand and higher rates of infection. There are things we can't predict. Storms Berts and Dara have added pressure and we might have a cold snap. I know many people like a winter cold snap of snow and ice, but it's not something the NHS ever wants to see. The NHS has excellent people that have done this before, and unlike last year, thanks to this new government, many of them won't be on strike. And while we can't control the weather, we can plan, prepare and pull together. So today I want to update colleagues with the current picture before moving on to the things we are doing. NHS England and the UK Health Security Agents will publish the latest statistics tomorrow morning as usual, but we do know that levels of seasonal illness are high. The most recent figures show that last week there was a 350% increase in flu cases compared to the same week last year, but this is comparable to levels we saw 2 years ago. Norovirus cases are high, COVID rates are low, and although RSV rates have been high, we expect them to start coming down over the next few weeks. And I want to make it clear that the current rate for both bed occupancy and ambulance delays are unacceptably high, and I will shortly come on to measures about how we are dealing with that capacity. I'm not going to re-rehearse the Darcy investigation and his findings, except on one thing, to remind the House that he found, and I quote, a perpetual bed crisis, particularly during peak periods like winter cold snaps. This means every winter our staff have been wasting precious time solving process problems, ringing round wards to find beds and desperately trying to hold the system together. And you can see this in the figures. Yeah. On an average evening in 2009, a patient would have been 39th in the queue when they arrived at a typical A&E. In 2024, Madam Deputy Speaker, they would be 100th. The 4-hour A&E standard has not been met for nearly a decade, and ambulance response times have not been consistently achieved since their introduction in 2017. In November, the average ambulance response time stood at 42 minutes, which is more than double the NHS constitutional standard. Yeah. A third of 2.3 million people who attended A&E last month waited more than 4 hours. And 1 in 10 of those people, more than 150,000, waited for more than 12 hours in A&E. These life and death delays are the result of deep structural issues in the NHS that can't and won't be fixed overnight. But this winter, Madam Deputy Speaker, NHS staff will be on the front lines, not the picket lines, because we took a different approach on how to work with staff and the unions. To resolve the resident doctors' dispute, we spoke to them on day 1, we met them in week 1, and by week 4 we'd negotiated a deal to end their strikes. That's why, for the first time in 3 years, Madam Deputy Speaker, this government are fully focused on winter and not focused on planning for strikes. So this is what we're doing. First, the NHS is managing extra demand by strengthening same-day emergency care, offering more full services for older people with an upgraded 24-hour live data centres. Second, we're continuing to support systems that are struggling with direct intervention through NHS Urgent and Emergency Care Tiering Programme. Third, the Secretary of State is chairing weekly meetings with myself and senior leaders to make sure we're managing pressures across the entire system. Last week, he specially convened with Trust and told them to prioritise patient safety by focusing on key metrics, including emergency ambulance response times, addressing handover delays and tackling the longest waits in A&E. And we've made it crystal clear that we do not want to see Trust prioritising patients who can be seen and discharged more quickly over those with the greatest clinical need, because this government will always prioritise people, not performance. And this morning, the NHS has published a letter outlining how they were prioritising patient safety. Fourthly, I'm taking steps to ensure we get a clear picture of what's happening on the ground. I recently visited Newham Hospital, A&E, Bristol Southmead and the head offices of NHS England to see the aforementioned Operational Control Centre, where they receive data in real time and respond to problems as they emerge. And fifth, Madam Deputy Speaker, we launched the National Comms campaign in the autumn. This is encouraging people across the country to take their winter vaccines with a particular focus on people who are less likely to come forward. This last point is essential. Because the best and easiest way to keep people out of hospital this Christmas is to encourage them to come forward and get vaccinated. For instance, last year, people who received a COVID vaccine were half as likely to be admitted to hospital compared to those who didn't. So far, we've delivered over 17 million flu jabs, 9.5 million COVID jabs, and we introduced the first ever public vaccination campaign for RSV, with over 1 million vaccinations delivered and counting, protecting young babies and the elderly. In total, we've delivered nearly 28 million vaccinations for this winter, and I want to thank every person who's come forward to protect themselves and the vulnerable. And now I'd like to speak directly to anyone who hasn't been vaccinated. No one wants to be separated from their family and stuck in hospital this Christmas, and there's a real risk that maybe you'll inadvertently take home flu to loved ones this year. So please protect yourself, your family and NHS services, and book your appointment today, because tomorrow is the last day you can book a vaccine through the NHS app or the NHS website, although after tomorrow, obviously, there are local solutions. Madam Deputy Speaker, while we tackle winter pressures in the short term, we're also fixing the foundations of our NHS with long-term reform. 2 weeks ago, the Prime Minister spoke to the nation about our plan for change and set out our ambitions for the health service over this Parliament. We will get a grip on waiting lists and return to 92% of patients waiting no longer than 18 weeks from referral to treatment by the end of this Parliament. We're also taking action on social care, introducing the largest increase in the carers allowance weekly earnings limit since 1976. We will ensure carers allowance meets its objectives while reviewing unpaid carers leave and looking at the benefits of introducing paid carers leave. We will publish an improved Better Care Fund framework using £9 billion of funding to provide better, more integrated health and social care for patients and people who draw on care. We're helping disabled people on low incomes adapt their homes through the Disabled Facilities Grant. And the Employment Rights Bill is already going through committee stage, laying the foundations for the first ever pay agreement for care workers, as a first step towards building consensus on the long-term reform needed to create a national care service. By the end of our first year in government, we will deliver an extra 2 million operations, scans and appointments through innovation, investment into additional capacity and productivity gains. We are sharing the best of the NHS with the rest of the NHS, with our further, faster team. These are teams of experts that are supporting 20 trusts with long waits to tackle their waiting list and increase productivity. They've been deployed to 5 trusts so far, and we're already seeing improvements, for example, in theatres. For this financial year, the Government have committed £12 billion more in everyday spending on health and social care than was planned by the last Government in the spring budget. And we are giving our capital-starved NHS the funding it so badly lacked over the past decade, setting aside at least £1.5 billion next year, which will create additional capacity, including new surgical hubs and diagnostic scanners and new beds across the estate, which will enable 30,000 additional procedures and over 1 million diagnostic tests as they come online. That's the difference a government of service makes. But we've also been clear, investment must come with reform. And Lord Darcy has given us the diagnosis, and the cure can be found in shifting the NHS from treatment to prevention, hospital to home and analogue to digital. So, Madam Deputy Speaker, in conclusion, Harold Wilson once called himself an optimist who carries a raincoat. As someone who has worked in our NHS at this critical time, I'm fully aware of the challenges we face and the effort that's required. And I'm making sure that we have a firm hold of problems in the short term while we do the work of fixing the foundations of the NHS with long-term reform. Over the past 14 years, we've limped from one crisis to the next, improvising and making do with sticking plasters. It can't go on. It's bad for patient care and it's totally demoralising for staff. We are building a health service that's fit for the future, ready to face every winter with confidence, and we will publish our 10-year plan for health in the spring. And anyone who thinks you can't do it should remember, we fixed the NHS before and we'll fix it again. The public rightly expect us to put an end to the annual winter crisis, and that's what we'll deliver, and I commend this statement to the House.
The Shadow Secretary of State, Ed Argar.
Thank you very much, Madam Deputy Speaker, and I'm grateful to the Minister for early sight of her statement, as I've said before, typically courteous of her, so I'm grateful for that. And I would echo the gratitude she expressed to those in our NHS, but also those in the social care workforce who will be working hard throughout the festive period. Now, as she's alluded to, the NHS is already feeling the pressure this winter. We know that winter is always tough for the NHS, irrespective of who is in government, but services are feeling the strain even earlier than in previous years. A tidal wave of flu infections has led to a 70% increase in hospital cases in just 7 days, and the National Medical Director of the NHS has warned of a quademic of health emergencies as cases of COVID, norovirus, RSV and the winter flu are all on the rise. Meanwhile, in October, the longest A&E waits of over 12 hours increased by over a quarter in just 1 month, reaching the third highest monthly figure since comparable records began in 2010. Now, all this, of course, has come before the cold weather really hits and before more vulnerable pensioners are left in freezing homes, unable to put the heating on after the scrapping of the winter fuel payment for a large number. So I'd ask the Minister what assessment she and the Department have made of the potential impact of that on hospital admissions this winter. In government, we recognise the NHS faces unique challenges in winter. We also recognise, as the Minister I know does from our discussions previously, the importance of flow in the NHS, working with all parts of the system working together. That's why last year we provided £200 million to boost NHS resilience specifically during the peak winter months, which was accompanied by £40 million to bolster social care capacity and improve discharge from hospital. This followed the £1 billion announced earlier that year to boost capacity by delivering 5,000 additional beds, 800 new ambulances and 10,000 virtual ward places. Now, the Secretary of State himself has admitted there would almost certainly be a winter crisis, and there have been warnings from the Royal College of Emergency Medicine, Royal College of Nursing and directors at NHS England. Yet in today's statement, in contrast to the steps we took, we heard a lot about data, a lot about meetings, a lot about coordination, but very little set out in concrete terms to actually increase capacity specifically over the winter period. And this will give scant reassurance to those working in the system or patients needing the system. In fact, earlier this year, the Secretary of State suggested there would not be any specifically new funding for the NHS to cope with winter pressures. She will know that I've tabled a number of written questions in recent days to be met in many cases by what seems to be, for name day questions, the standard DHSC response of a holding answer. So as the pressure continues to grow, can I ask the Minister a number of specific questions while she is opposite me at the dispatch box? Will the NHS receive more resources specifically to surge capacity this winter in beds and in A&E? What is her assessment of whether there are enough hospital beds and ambulances for this winter, or is she taking steps to increase them? How many people, as at the first of this month, who were medically fit to be discharged were not able to be for a variety of other reasons? In terms of winter vaccinations, I'm grateful for the update she's provided. What assessment has she made of the supply of the vaccine and the flu vaccine, with some suggestions that some pharmacies and others have run out and are waiting for more deliveries? How many additional 111 and 999 call handlers have been recruited specifically for this winter? We talked briefly about the need for the system to work as a whole. In that context, what about the impact of NICs on hospices, social care and GPs, all hit by that? Now, I know the Secretary of State, before the Select Committee this morning, said that hospices would get an answer from him, an update from him before Christmas. But at PMQs, in response to the Leader of the Opposition, the Prime Minister appears to say it will be after Christmas. Can she just clarify for the House? Because I think it's an important point. And finally, Madam Deputy Speaker, what meetings has the Secretary of State personally had with Julian Redhead and Sarah Jane Marsh, the NHS winter leads? And when was the first of those meetings specifically on this subject? I'm very happy for him to write to me if that's easier, given the complexity. So, as seasonal flu piles yet more pressure on NHS systems, it's more important than ever that it gets the resources and the support that it needs. And while there are many promises of reform, it needs that immediate capacity boost to beds over winter. So far, they've kicked reform into the long grass in favour of yet more consultation, and the preparations for winter have lacked the urgency and focus patients and NHS staff demand. In government, we always put extra support in place to keep the NHS going through the tough winter period, boosting capacity and increasing support. This government needs to get a grip and do the same.
Thank you, Mr. Minister. I'll do my best to address that range of questions. Firstly, I'm just going to, on the basis the stop clock is always right once, can I agree with twice the honourable gentleman Well, on correspondence and answer to PQs, a situation again we inherited. It's not satisfactory, and I'd like to apologise to all members who are waiting for correspondence, something that we are personally taking a grip of, and questions. We want to respond positively. They didn't. We will make sure that starts to happen. In terms of capacity in the system, again, if I remind everybody that we came into office in July, which is 1 quarter through the planning and financial year. So very rapidly, we looked at the plans that were baked in by the last government. I appreciate that he was, I think, in Justice at the time, so not in the department, to see if they were fit for purpose. We wanted to make sure we brought stability to the system. There are, in fact, more beds available currently in the system than there were last year. If there is a need for an increase in capacity due to a likely cold snap, if that happens, he will know, and the system is absolutely ready to respond to that in its usual way. That is why we are meeting weekly. In terms of the clinical and managerial college from NHS England, I mean, frankly, I see them more often than many members of my own family. And we immediately got to meet. I would have to check the exact date that we started meeting, but it was certainly in the summer. And I have had fortnightly meetings from September, which we moved to monthly meetings, as I said, chaired by the Secretary of State. So absolutely getting a grip from day one, knowing winter was coming. That's why we're monitoring it weekly. That's why we visited the operational centre to understand in real time what is happening across every single system, across every single trust, be it ambulance issues, be it problems at the front end in A&E. The one question I don't have directly to answer is what the daily figures are. I will try and get them later to him on discharge, waiting for discharge to assess. We all know that that is a massive problem. That's why we want to take a grip, as I said in my comments, of the better care front to make sure that that works better and stabilise the social care system. I'm not particularly versed in issues, apologies if that is wrong, Madam Deputy Speaker, about supply. We will certainly get back to him on that, because we do want to make sure that people are taking the vaccinations where necessary. On hospices, I can confirm that we would want have an announcement before Christmas with regards to winter fuel and the impact of that, as they know that we will continue to monitor the impact of all situations on individuals to make sure that they are supported in the community, and we do urge people to make sure that they access pension credit. And if I've missed something, I've just addressed that, so if I've missed anything else, I'll come back to it.
Rachael Maskell.
Thank you, Madam Deputy Speaker. Despite York's new ED department, a consultant has written to me to describe the situation he finds in emergency medicine, where patients are waiting 4 days for discharge from A&E and 50 patients waiting to be placed on the wards. We know we've inherited an NHS which is broken. However, could the Minister say what she is doing to enable primary care to pull more out of emergency medicine, to see people in the community, and also to invest in social care, which clearly will address some of the backlog and the logjam in patient flows?
I thank my honourable friend for her comments, and she, of course, reinforces the point about how much pressure we understand is in that front face. A&E is demonstrative of the overall pressure in the system, not both at discharge, but as she rightly says, at primary care. We took action in the summer to improve the situation of primary care, increasing the number of GPs that are available in the system. It's absolutely critical that at a local level, primary care, community services are integral to that, into that winter planning. That's what we expect from every single system. We will continue to monitor that over the winter period and into the spring. If they are not in any particular systems involved in that planning, so that they can monitor the sort of the surge and flow of people through the system, we very much want to understand how that's working in local systems.
Yeah. Democrat spokesperson Helen Morgan.
Thank you very much, Madam Deputy Speaker. Can I add my thanks and those of my Lib Dem colleagues to everyone who will be working over the Christmas period to keep people healthy and safe. Preparedness for winter is absolutely critical for our health and care system, and a quick look at what happened last year shows us why. Ambulances across England collectively spent a total of 112 years waiting outside hospitals to hand patients over, and 250,000 people waited over 12 hours to be seen. Every winter, we are warned of a winter crisis, and under the Conservatives, crisis became the norm, not just in winter, but all year round. This year is very, very concerning so far. A&Es have been overflowing through spring, summer and autumn. At my local hospital trust, Shrewsbury and Telford, 1 in 3 ambulances have had to wait more than an hour to hand over patients. Patients with devastating cancer diagnoses have had to wait months for crucial scan results, and across England, more than 7 million people are on waiting lists. And meanwhile, I'm afraid we haven't heard enough from the government to fix one of the root causes of this crisis, and that's our broken social care system. The scale of the crisis is demonstrated by the challenges facing ambulance services across the country at the moment. In October, before the winter, it was the 3rd worst month ever for handover delays at West Midlands Ambulance Service, which covers my constituency of North Shropshire. The equivalent of 130 ambulance crews are out of action, waiting every single day. And now these overstretched ambulance services are formally changing their advice to reflect the pressure they're under. At times of peak demand, even Category 2 patients suffering a heart attack or stroke will be asked to make their own way to a hospital. Now, people in North Shropshire have long had to put up with some of the worst ambulance waits in the country, and they have come to harm as a result of it. And it may no longer be the case that they can rely on an ambulance surviving. Action is urgently needed to prevent more preventable deaths this winter. I'm sure the Minister shares my alarm that ambulances may not be reaching people facing life-threatening situations. And if she does, will she commit today that the government will tackle the handover delays that are paralysing the ambulance service by accepting Liberal Democrat proposals to make a £1.5 billion fund to provide more staffed beds and urgent cross-party talks to fix the crisis in social care?
I thank her for her comments, and I think I've addressed our plans with regard to social care. I think she makes some excellent points with regard to ambulance delays, which we do know are a problem, and they are a particular problem in the West Midlands. They are one of the things that I particularly ask the system to look at, and for us to understand better, and for honourable members to understand better, is what are the particular problems in their particular systems. And we do know that ambulance delays and handover are a particular problem in some systems. We are making sure that the clinical and managerial leads from NHS England are visiting those systems, that they are understanding in depth what are some process issues, that some places are perhaps not adopting the best practice that is learnt from others. We need to roll out best practice across the country. There are some interesting, the Secretary of State and myself, when we visited the operational centre and we visited London Ambulance Service, sat on some calls about hear and treat, particularly dealing with people in mental health crisis differently. Some places are doing that better than others. These are the sorts of examples we want to learn from, but I absolutely hear what she says about the unacceptable delays in particular parts, and they are in particular parts of the country, and that is something that's very much on our priority list.
Committee member Jen Croft.
Thank you, Speaker. Last week I visited Basildon Hospital, which is relied on by my constituents in Thurrock as well as people across Essex. In the emergency department, staff told me that they were operating under intense pressure all year round, and that indeed it is indeed winter all year for them. This is due to a lack of beds, the terrible condition of parts of the estate, and also due to inadequate primary care services, meaning that people turn up at the ED when they should be somewhere more appropriate. And what steps is the Minister taking to turn the page on 14 years of decline and ensure that Basildon and hospitals across the country have the resources and structures they need to better manage seasonal and year-round pressure?
I thank one friend for her question, and she has already been a fantastic advocate for her local NHS services. And she's absolutely right to highlight, as did the Honourable Spokesman Member for Liberal Democrats, about the acute pressures all year round. We didn't always have winter crises under the last Labour government. It was tough. I worked in some of those times, so it did happen. But this getting used to the levels of bed occupancy and pressure in the system all year round is a direct legacy of the party opposite and what they did to the NHS, particularly with Lansdowne reforms, and then a refusal to take a grip of it. So this summer crisis going into winter crisis is a real problem. That's why we are committed to these short-term issues to make sure we stabilise and support the system over the winter. But as I said in my statement, make sure that we look at the medium and longer-term reform so that we don't have to revisit this scenario year on year.
Select Committee Chair Layla Moran.
Deputy Speaker. Last Friday I visited Sherwood Pharmacy in Abingdon, and what Ben, who owns it, told me is that local pharmacies stand ready to help. In fact, they are more than keen to. But there are two things that he needs from this government. One is a real push for GPs to be referring, particularly for vaccination, into pharmacies so that you're not collecting patients in one part of the system that's already overstretched and that they can do what they do best. But the second is a general plea to the public that they can go to their pharmacies for these things. I note that in her statement, the Minister didn't mention pharmacy once, and let's be honest, this question isn't going to do it either. How do we make sure that the message gets out there that this winter, go to your pharmacy, get vaccinated, and you can do it faster there?
I thank the Chair of the Select Committee for her point, and actually she is right. I didn't mention pharmacies, and that is an omission on my part. We are running an advertising campaign for Pharmacy First and to make sure that people can use pharmacies. She's absolutely right. They are standing ready. I will be visiting mine over the next few days to make sure that I am also vaccinated, and their support and working with primary care is absolutely critical. Again, it's something that works very well in some places where you've got those relationships working well, and they do support people in the community, and that is apparent in the statistics. We're absolutely committed to making sure that works better as part of our long-term reforms.
Deputy Member Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. Last week, Colesdale and Huddersfield Foundation Trust bed occupancy was at 99.6%. Madam Deputy Speaker, 20.1% of those beds were taken up by people who could be treated elsewhere because of the failure of social health care and community care. Madam Deputy Speaker, all I want for Christmas is a reassurance that next Christmas and next winter, social care will be on a more secure footing. Thank you.
I mean, he's absolutely right to highlight those shocking levels of bed occupancy. As I said in my earlier comments, running consistently at that high level of occupancy is something that we should never have got used to. It is demoralising for staff, it's very bad for patients, and it's a sign of the pressure in the system as well as that discharge rate. We absolutely have to make sure that the system is incentivised and works properly to make our hospital to community commitment in our 3 shifts operate in practice. People don't want to be in hospital when they don't need to be. It's not the best place for them to be, and we'll be saying more about that in the new year.
Wendy Morton.
Thank you, Madam Deputy Speaker. We hear today about a massive backlog at the DWP in processing pension credit and winter fuel payment claims. Bearing in mind cold homes, increased winter deaths and hospital admissions, and we're debating winter preparedness today, I'd like to ask the Minister what discussions she's had with the DWP to ensure that those who are waiting in my constituency for their winter fuel payments will receive them before the Christmas break, and will she commit to publishing a full impact assessment of that decision on the NHS?
I thank the Honourable Lady for her question. I think we have discussed this issue a number of times in this place. We absolutely understand the impact actually of cold and of heat actually throughout on the system on people. It's something we need to address more generally. She will be aware that discussions are continuing with the DWP on this issue. If there are specific examples that she wants to raise with me or the department, I'm very happy to look at it.
Chris Vince.
Thank you, Madam Deputy Speaker. And can I welcome today's statement and take a moment to thank emergency services across Harlow and across the country who have given up their Christmases, given up to spending time with their families at Christmas to keep us all safe. East of England Ambulance Service have set up a new process to try and support paramedics and also support Princess Alexandra Hospital, which will give them a direct line to a GP who can triage patients and send them to the right department straight away. Can I ask what the work the Department of Health and Social Care have done to work with ambulance services across the country to learn from them and to share good practice?
Well, again, already in this place, he's making sure that he is representing the people of his constituency so well by absolutely getting to the heart of what's going on in the ground and learning for himself and being able to bring that example to the House, because he's absolutely right. There are examples like this across the country that are working differently in different systems that are challenging other systems, perhaps to look at that practice. That's why we say we want to bring the best of the NHS to the rest of the NHS. That's exactly what we mean. And I am confident in the work that's happening centrally at NHS England, that they are learning from these and wanting to go around the country to make sure that we spread those sorts of ideas to other places. We're looking very closely at them all.
Select Committee Member Andrew George.
Mr. Speaker, in the far west of Cornwall, with a medical emergency, we can't look for additional support from the north, west or south because it's sea, and the urgent treatment centre at Penzance Hospital was closed at night 2.5 years ago under the Conservatives, adding pressure on the only emergency department for the next 100 miles at Truro, and the out-of-hours doctors' service has no doctors. So she mentions in her statement that the NHS Urgent and Emergency Care Tiering Programme is able to help. Could she use her influence to reopen the urgent treatment centre so that we can have a 24/7 emergency service in the far west of Cornwall? Thank you.
The Honourable Gentleman tempts me to make commitments from the dispatch box, which I'm not going to do. He does make a very serious point. The sea is an issue for many honourable members in the impact that it has. Very beautiful though it is, it does have an impact on the ability of the system to manage different areas. In looking at different solutions for populations such that he represents, be that 111, be that hear and treat systems, be that more use of technology to support people and pharmacies and community out of hospital care, is exactly what we think is the right way to go over the next few years as part of the long-term plan. That may be a building with services, it may not be. I think that's something we need to look at in the round and learn from what works well in different sorts of systems.
Questions seem to be getting longer and longer, as do the responses. Let's try and keep the questions on point. No doubt the answers will be the same as well. Lizzie Collins.
Thank you, Madam Deputy Speaker. When I started working in public health, winter pressures were just that. You know, seasonal flu, extra hip fractures. Then under the Conservatives, the winter started getting longer and longer. So can I ask the Minister how our 10-year plan will ensure that seasonal pressures actually become seasonal and manageable again?
She makes an excellent point. We do need to get back to normal, and we need to recognise that there are different things that happen to the system at different times of the year, and much of which is predictable, and we need to make sure that the system is strong enough to be able to cope with those differences.
Dr. Neil Hudson.
Thank you, Madam Deputy Speaker. As we come into the height of winter, will the Minister join me in thanking all the amazing people on the front line, diagnosing, treating and caring for people right across the country? But with multiple infectious disease challenges, the impacts of cold and extreme weather, the risk of falls and accidents, will the government please now rethink their policies on winter fuel cuts and national insurance rises, which will exacerbate the situation and compromise the delivery of primary health care, social care and hospice care?
Well, look, I agree with the Honourable Gentleman in thanking everyone working in the system as agreed. The NHS is getting, as I said, £12 billion more this year from this government than it had from the last government, from the last spring budget. And we are now focused on making sure that money is used properly.
Swallow.
Thank you, Madam Deputy Speaker. Let me use this opportunity to thank the healthcare workers in Bracknell Forest who will be working so hard across the Christmas period to keep patients safe this winter. Yeah. Does the Minister agree with me that we must make sure that not only do we have the right investment into our health services, but also the right reforms so we can fix the broken NHS and get it back on its feet?
He is absolutely right. We want to make sure that taxpayers' money is used efficiently and effectively in the right places for the right treatment at the right time. That is why we are looking at our long-term plan. That is why we want to stabilise the system so that we don't have to keep coming back here year after year with the so-called winter crisis.
Mike Martin.
Thank you, Madam Deputy Speaker. I thank the Minister for her statement, and I note that she thinks that the absence of the word pharmacy in the statement was an omission. I wonder if she also thinks that the absence of the word general practice in the statement was an omission. In Tunbridge Wells, I've been going around some of my GP surgeries, and one of them told me that as a result of the NIC rises, they will have to face charges of £40,000, which is a staff member, and they're going to have to look at laying off a member of staff. So could the Minister please explain to me how GPs laying off staff is going to help them cope with the winter crisis?
Well, as I think the honourable gentleman knows, I can't talk about individual cases from the dispatch box, and we will be making announcements on that very shortly.
How convenient.
Lewis Atkinson.
Thank you, Madam Deputy Speaker. I thank the Minister for her statement and also the work of my recent former NHS colleagues, especially those in Sunderland, for what they do over this winter. The Minister has rightly highlighted unacceptable levels of bed occupancy going into winter. We know that as bed occupancy increases to unacceptable levels, there's a rise in patient safety risks. So can I ask her what assessment she's made of the patient safety monitoring regime over the winter linked to those risks?
I'm grateful to my honourable friend for his questions. We've made absolutely clear, and the NHS in its letter today has made absolutely clear, that patient safety is the watchword absolutely this winter. We do have targets in place that monitor performance of the system, but we absolutely want to make sure that patients are kept safe as we go through the next few months.
Job?
Madam Deputy Speaker, I was speaking to an elderly gentleman yesterday who was taking himself off to his local pharmacy to get the RSV jab, but because he's over 80, he was going to be paying more than £200 for it. Could the Minister please tell us how much the RSV jab is to the department when they give it free to 75 and 80-year-olds, and how much guidance or limitation they place on the profit that can be taken by chemists when giving it to people who are 80 plus?
I think the honourable gentleman knows that I'm not able to do that from the detached box, but in a specific case, officials will have heard that request, that I will make sure he gets an answer.
Alice MacDonald.
Deputy Speaker, and I also want to pay tribute to the hard-working NHS staff in Norwich and Norfolk. In Norfolk, the County Council has used AI to identify more than 1,000 people at risk of being admitted to hospital because of falls this Christmas. Would the Minister welcome this use of AI and expand on how we are using technology now and in the future to help alleviate winter pressures?
I don't wish to test the Chair's patience, but I think the situation we've got to with falls and falls, good falls practice in the last decade, not prioritising that, not going on with the work that I know was in place many years ago, is yet another testament to the failure of the party opposite. And she's right to highlight now about how we can use things like AI to help the system get better, so that this hugely preventable issue that is so damaging, particularly for the elderly, doesn't happen.
Greg Smyth.
Thank you, Madam Deputy Speaker. Winter pressures do come around for all sorts of reasons every year. The difference this year was the political choice to take the winter fuel payment away from millions of pensioners. Worse still, the 44,000 pensioners living with a terminal illness that will lose their winter fuel payment. I cannot believe that a minister as diligent as the Honourable Lady hasn't done an impact assessment on the cost to the NHS of people being left in cold homes and the impacts that has. My honourable friend, the Shadow Secretary of State, and my honourable friend, the Member for Aldridge Brown Hills, asked for that assessment. Can I give the Minister another chance to commit to publishing it?
The honourable gentleman is wholly wrong that winter crises happen under every government in every year. They happened and became a fact of the NHS under his government. And the difference this year, the key difference this year, which the party opposite still won't address, is that doctors are not on strike. Doctors are working in the system, they are caring for patients, they are doing their job, because this government on day one and week 4 delivered the negotiated settlement by the doctors. You can't run an NHS, you can't run a winter crisis without doctors in the front line. That's where they are. That's what the difference is.
Laura Kirk-Smith.
Speaker, and it is great to be going into winter for the first time in 4 years without the doctors on strike. Last week I visited the new emergency medical receiving unit at Stoke Mandeville Hospital. It's a new 21-bed facility to provide quicker care for patients who come in from ambulances and GP referrals but only require short admission, and the early results look really promising. Does the Minister agree with me that we have to take these pockets of good practice from across the NHS and ensure that other parts of the NHS learn from and adopt them to help us get through this winter and future winters?
Again, I commend my honourable friend for, again, being a new MP and getting to grips in detail with what's happening in her local system and bringing those examples of good practice, challenging her local system, but bringing those examples of good practice to this House, and so that we can all learn from them. And she's absolutely right. There are many of them across the country. We want to learn from them, and we want to make sure they are mainstreamed where possible, different solutions for different systems, but she's absolutely right to highlight that.
Manuela Pettigella.
Thank you, Madam Deputy Speaker. I refer the House to my register of interest as a member of the UCLH NHS Foundation Trust. The upcoming rise in national insurance contributions will cost our GP surgeries the equivalent of over 2 million appointments a year. General practice is the cornerstone of the NHS, is our front door. Many GPs in my constituency of Stratford-on-Avon have written to me with their serious concerns. Does the Minister recognise the hiking cost for family doctors will only worsen pressures on our hospitals, pushing more people to A&E and stopping many from getting the care they need?
We recognise all the costs that GPs as contractors have and many other parts of the systems, as we have addressed many times in this House. We also recognise the improvements that we have made to the system by improving the number of GPs in the system and funding the NHS more than was done under the last government. We will continue to look at that in the round to make sure that we have a sustainable system.
War. Speaker, one of the main reasons I became a politician is because my wife is a midwife, and she would come home night after night complaining bitterly of staff shortages on the wards. Can she reassure me that maternity services will get all the funding that they need over this winter? And also, would you like to join me in thanking all those maternity staff who work so hard over Christmas, New Year and all year round?
I thank my honourable friend for making that point, and he's absolutely right. There are many tragedies that happen over the Christmas period. I remember my own father died on the 23rd of December. People go above and beyond to help people at a difficult time, but also times of great joy. Babies don't wait for Father Christmas, do they? And those midwives and everyone else who's working, he's right to commend them. We know that maternity services are particularly stretched across most of the country, so that those midwives are doing a tremendous job to keep the system working and doing that critical, important job of supporting women at a really mostly joyous time and sometimes a very difficult time, so I'm very pleased to do that.
Alison Bennett.
Thank you, Madam Deputy Speaker. At the start of this week, there were 300 patients who were ready to go home from my NHS Hospital Trust in Sussex. That bears out the statistics in Lord Darzo's report that 13% of patients are medically fit for discharge. I'm really concerned that we've got to a point now with winter pressures where corridor waits are normalised, not only within A&E departments, but with initiatives like continuous flow models, seeing corridor trolley waits being pushed out into regular wards. I think it's unacceptable that this has become normalised. Will the Minister expand on her comments about the National Care Service? When will the plans be published? Will the government work on a cross-party basis with us? And why has this work not begun sooner?
I mean, as I said in my statement, we have begun plans to stabilise the workforce, and we've got the employment bill going through at the point, so I don't agree with the Honourable Lady on that. We know that's going to take a long time, and we will, of course, be working with colleagues to make sure that we do develop that National Care Service.
Amanda Martin.
Thank you, Madam Deputy Speaker. I'd like to begin by echoing the words of the Minister and thanking particularly the fantastic NHS workers and wraparound service who provide a vital service all year round, but particularly in winter in Portsmouth. And I'd also like to thank all those members that turned up to the joint NHS consultation with myself and my fellow Ports of South MP. Can the Minister reassure me, because unfortunately under the scale of damage by the last government to the NHS, it means that our NHS providers have to make very difficult decisions at this time. So can the Minister reassure my constituents that patient safety and particularly emergency services will be this government's first priority this winter?
Minister.
Very pleased to reiterate that safety is absolutely the watchword for winter, as it is all year round, but we absolutely want to stress that's why NHS England also wrote out about that today. And I commend her for meeting with constituents locally. I commend all honourable members to do that, and we are getting some fantastic ideas from staff and from patients about how to reform and change the system for the long term.
Jess Brown-Fuller.
Thank you, Madam Deputy Speaker. 1 in 4 people trying to get in touch with their GP last month were unable to get a same-day appointment, and 1 in 20 couldn't get through to their GP at all. We know that these people then end up in A&Es up and down the country, and hospitals are already buckling under the strain. So what is the Minister doing to better support GP surgeries and frontline services during this winter crisis, especially while they navigate the challenges of the employer NICS rises?
Madam Deputy Speaker, I think referring back to my statement in terms of how we are supporting the system, we absolutely understand the importance of primary care. We also understand the importance of using 111 to make sure that people are directed and get the right care in the right place. We know that the system is pressurised, and we will continue to do all we can for the longer term as well as in this short term to support them.
Emma Foodie.
Thank you, Madam Deputy Speaker. Recently, I visited Northumbria Specialist Emergency Care Hospital in my constituency in Cramlington and met with staff there as they shared their concerns about winter pressures. Every year, they closely track the flu seasons in Australia, given that the patterns that emerge there are often what follows here, and they are extremely concerned about what we are going into this winter. Can I ask, what steps have the department taken and are they continuing to take to ensure that as many people as possible are vaccinated ahead of this winter?
I'm grateful for her for that, and I'm working very closely with the UK Health Security Agency to do exactly that, to make sure we are aware week on week about the movement of different diseases and viruses through the system, and we will continue to publicise that campaign, and anything that honourable members can do to support the campaign to get people vaccinated and make sure they support themselves and their loved one will be gratefully received by the entire system and something that everyone can get part of.
Dr. Danny Chambers.
Thank you, Madam Deputy Speaker. And while we all pay tribute to the NHS staff who work over Christmas, we should also remember that they're not only missing Christmas with their families, but they're actually putting their own health at risk to take care for us as well. Madam Deputy Speaker, on Monday of this week, Winchester Hospital declared a critical incident, saying they could admit no more patients and asked them to seek treatment elsewhere. For years, the CEO of the hospital has been requesting 160 extra social care packages because that is what's stopping flow through the hospital, and she said it's the single biggest thing that would help deal with the winter crisis. And Madam Deputy Speaker, earlier this year in September, the Winchester Hospital applied for winter crisis funding to put an urgent treatment centre on the front of their A&E to help deal with what the anticipated extra caseload, and it's now December and they still haven't heard whether they will get the funding. So, given the critical incidents being declared, will the Minister meet with me and the CEO of our hospital to discuss how we can support them through this situation and also how we can avoid having a planned crisis next winter?
Madam Deputy Speaker, obviously different systems, as I've said earlier, do have different issues. Funding has been allocated in advance to the NHS so they know and understand what systems require what funding, and that has been baked in now for this year. I can't address the Honourable Gentleman's points directly from the dispatch box. I'm very happy for officials to take note of that and to check with the system what is happening in his particular community. Obviously, it's important that they work closely with their local authority with regard to discharge. We are wanting to improve the Better Care Fund, and I'm sure he will be working with the local authority and his hospital to make sure that that works better.
Final question, Clive Jones.
Thank you very much, Madam Deputy Speaker. I declare I am a governor of the Royal Berkshire Hospital and I have a family member who has shares in the medical company. The Royal Berkshire Hospital have experienced their highest increase in emergency department attendances heading into the winter period, and yet the estate of the Royal Berks is crumbling, out of date and not fit for purpose. People with infectious diseases like flu, COVID and norovirus cannot easily be isolated due to poor air circulation, only making the situation worse. When will the Royal Berkshire Hospital be rebuilt, and will the Minister visit to see the full extent of our challenges? And finally, can I wish the Secretary of State and the Minister a Merry Christmas? Take a short break, but come back quickly to continue to clear up the Conservatives' massive failures in the NHS.
Across the floor.
Well, Madam Deputy Speaker, we will be making announcements hopefully as soon as possible in the new year on a point about the Royal Berkshire Hospital. As I know that's an issue of great concern to all honourable members. Look, we just want to finally thank. We know that it's going to be a pressurised system. We really want to thank everyone working in the system. We want to make sure that everyone keeps well. And I'll take this opportunity also to thank the Honourable Gentleman for his comments. And I'm looking forward to returning back here in January, hopefully, to answer more questions. And thank you for all those this afternoon.
At the end of that statement, I'll give the front bench a few moments to shuffle over as we